My name is Dr. Wachira. I'm a pediatrician. I work here at M.P.Shah.
I'm Dr. Mate. I'm also a pediatrician at M.P.Shah Hospital.
Today we are going to focus on Covid-19. There is a lot of talk out there about coronavirus, and today we'll talk about parents and their children. Most parents are worried or concerned, or they'd like to know how to communicate about coronavirus with their children.
Because you have a lot of mothers coming with smaller babies, and if you feel that you have the symptoms or you've even been diagnosed with COVID.
We are learning lessons from other countries. Kenya is not the first country to get this virus, and therefore we are lucky. We have the advantage of learning from other countries. I would say the first step would be for them to address their own fears, their own anxieties, their own concerns about coronavirus. Simple ways about communicating about coronavirus. What is coronavirus? Use age-appropriate or development-appropriate terms.
Yeah.
As to a small baby, it's just a germ. It's just a bug. In Kenya, it's a doo-doo. So, whichever word they can use for the child to understand.
Yes.
For the bigger child, it's a disease, it's a viral infection. And then from there, they should be able to keep it factual and very clear. For example, they can say it's a cold, it's a flu,
Yes.
but a little different from what we commonly see.
Okay.
And then they should put it clearly that there are not many people with it.
And also encourage them to do certain things so that they feel they are also part of taking care of their safety. So when we talk about hand washing, then we need to show our children how to do the hand washing, how to use the soap. There's all this talk about washing your hands for 20 seconds, so you can sing with your children. They're saying you can sing the happy birthday song twice as you're washing the hands. So showing them proper technique and just encouraging them when you come out from playing, you need to wash your hands. If you're coughing, show how to use your sleeve or cough into your hand, and any cough etiquette.
Most important, they should do more of a question and answer thing. They ask the child and find out, what do you know about coronavirus? Then the child will be able to say what they have seen, what they have heard. And then the parents should now correct any misinformation and use that to give some basic information without giving too much unnecessary information. Parents should avoid overexposure. By what do I mean by that? The children should not be glued on the TV watching the news. Children love routines, and routines work well to reduce and minimize anxieties. They should have clear waking up time, clear meal times, and clear bedtime. And then a bit of varieties.
And during the day now, you want to encourage like creative activities. So if it's a new skill that you want your child to learn, it can be painting. You can teach them an instrument. You can do some dancing, playing some music. There are a lot of parents who you find you have very long work days usually, but now that parents are home with their children, do some things with the children, read for them, teach them how to ride a bicycle. There are all those games we used to play when we were younger. You can go skipping, you can play some hopscotch. So try and think of creative ways to just keep the children entertained during the day so that they don't feel very cooped up in the house. Parents also have to encourage them to have a very healthy lifestyle because these are some of the things that are going to be used to help them curb the illnesses, boost their immunity. I read somewhere that you want to encourage them to eat the rainbow. So basically that's what means you want food which are very colored. So when it comes to vegetables, you want the green vegetables, you want your orange carrots, you want them to eat fruits like bananas, tangerines, oranges, all the brightly colored fruits, because this is going to give them the vitamins that they need to boost their immunity. I don't think there is really need for most children to be on multivitamins or supplements at this point. What's your opinion?
Things like omega-3 found in fish, they should have fish regularly. Those who can take animal proteins, they can have the red meats. It has plenty of minerals and vitamins, the iron in it, the liver. They should also have plenty of different vegetables and fruit will meet that. There may be minimal need for bottled supplements.
That's very
Vitamin C can be found in oranges. They can have an orange.
naturally, yes. They just need to eat the natural foods. What we're encouraging is if you're sick, you take the necessary precautions. If you have to cough and your children are around, then you also exercise the same kind of cough etiquette and hand hygiene just to prevent that contamination. But we are encouraging parents to actually show love and affection and let their children feel safe and protected, because it's a scary time for parents, it's a scary time for children. So like he rightly mentioned, you need to calm your anxiety, and then you also pass on this calmness to your children.
There is a limit to how much you can distance parents from their 1 month old or 2 months or 6 months old baby.
Maybe wearing a mask, I don't know, when you're breastfeeding.
Yeah, you cannot breastfeed a meter away.
Yes.
You still need to breastfeed your baby. So they need to take their own precautions, and then from that, then they show love and affection to their children.
That's true. Yeah.
But we should know that there will be the normal coughs and colds will continue whether it's coronavirus or not. So not everybody who is coughing out there has coronavirus. What has worked in the countries where coronavirus is reducing is distancing, keeping away from other people. Wherever you are, keep away from other people. Whether in the rural area or urban area,
yes.
keep a distance. You may talk about being high in some countries than others, but you can't say that it is higher in the rural area or urban areas,
yes.
because there's the people who are carrying the bags with them. So if somebody has coronavirus and they move over to a rural area, they are going to transmit it over there. So keep a distance wherever you are. In this era of digitalization,
Yes.
where possible, they should even have digital visits.
For people who are able to use other social media sites, maybe whether it's Skype or Zoom, you can actually set up a conversation with them over Skype and have a chat with the grandparents without necessarily going to visit them and taking any risk factors that may be associated with visiting the older people back at home.
And more important, we should know that there are many other diseases that are going around. We should not just focus on COVID-19, we should focus on full holistic health in the home and in the family.
We still need to remember at the end of the day, we are still human beings. We need to be kind to each other, be considerate to each other despite what everybody is going through, and just take a moment to think about the person next to you and what they would need in this time that we are all experiencing together.